Aging for amateurs, the hidden dangers of summer haze on brain health. Aging for amateurs, the hidden dangers of summer haze. As summer unfolds, we find ourselves in the midst of sweltering days, with temperatures soaring above 90 degrees and humidity levels climbing to 75% or more. Weather forecasters are constantly reminding us to stay hydrated and to protect our skin with high SPF sunscreen when venturing outdoors. But there's more to these hazy summer days than just the heat. The term hazy doesn't only describe our view of the horizon, it also signifies an increase in air pollution. This raises an important question. What does this mean for those of us who are aging? You may already be aware of the connections between polluted air and respiratory or cardiovascular diseases. However, recent studies have unveiled a more alarming truth. Air pollution poses significant risks to our brain health as well. Research indicates that exposure to polluted air can elevate the chances of experiencing strokes, cognitive decline, Alzheimer's disease, various forms of dementia, and even Parkinson's disease. While the exact mechanisms behind these risks are still being explored, scientists are diligently working to pinpoint which components of polluted air are most harmful and the reasons behind their effects. 3 primary theories have emerged to explain how air pollution may negatively impact our aging brains. The first theory suggests that ultrafine particles found in polluted air can penetrate the blood-brain barrier, activating microglia, cells responsible for cleaning up debris in the brain. Unfortunately, this activation can lead to the destruction of neurons. The second theory posits that these harmful particles, once in the lungs or bloodstream, may trigger an immune response that results in inflammation within the brain. Lastly, the third theory indicates that air pollution may damage the blood supply to the brain, which could accelerate the onset and progression of Alzheimer's disease. Despite the fact that pollution levels in the United States have decreased by approximately 70% since the Clean Air Act was enacted in 1970, recent data suggests we might be regressing. The recently passed Big Beautiful Bill has further complicated matters by cutting funding for the Environmental Protection Agency, EPA, and relaxing automobile emission standards, which could exacerbate air quality issues. So, what steps can we take to minimize our exposure to air pollution? I've compiled a list of practical suggestions, drawing inspiration from Susan Fitzgerald's article in the February-March 2022 issue of Brain and Life magazine, published by the American Academy of Neurology. I've also added some additional recommendations and updates to enhance the list. 1. Keep your car windows closed and activate the recirculate air feature, especially when driving in heavy traffic. 2. Be strategic about exercising outdoors. If you prefer outdoor workouts, choose parks or open areas away from traffic, or opt for times when traffic is lighter. The South Carolina Department of Environmental Services offers a service called EnviroFlash, which provides daily air quality updates via text or email. You can sign up on their website at des.sc.gov/programs. 3. When outdoor air quality is poor, consider using indoor facilities such as community recreation centers, gyms, or shopping malls for your activities if available. 4. For yard work, consider traditional methods or invest in battery-operated electric tools like mowers and trimmers. If you hire a lawn service, encourage them to adopt similar practices. If they resist, seek out a more environmentally conscious company, as small gasoline engines are among the most significant sources of pollution. 5. Minimize idling in your vehicle whenever possible. Modern engines do not require warming up before driving, and idling wastes fuel while contributing to air pollution. 6. Outdoor burning should be a last resort for disposing of trash or yard waste. 7. Enhance your indoor air quality with portable air cleaners or purifiers, especially if anyone in your home has respiratory issues. These devices can eliminate about half of common pollutants, provided they are appropriately sized for the room and well maintained. Central HVAC systems with built-in filters can be even more effective if properly cared for. 8. Remember that everything we use has an environmental cost associated with its production. By reducing waste, recycling whenever possible, and being mindful of our consumption habits, we can lessen our carbon footprint and contribute positively to the environment. 9. Support initiatives that promote the natural environment, such as projects that create parks and hiking trails. Advocate for the preservation and expansion of green spaces, and consider planting trees or supporting organizations that do so. Instead of giving material gifts, honor special occasions by planting a tree through the Arbor Day Foundation or similar charities. 10. Make your voice heard by voting for candidates who prioritize environmental issues and advocate for clean air policies. Currently, the U.S. standard for fine particulate matter, known as PM 2.5, is set at 12 micrograms per cubic meter. According to the EPA Advisory Committee on Particulate Matter, long-term exposure to this level of pollution is responsible for an estimated 13,500 to 52,000 premature deaths annually in the U.S. They recommended lowering this standard to between 8 and 10 micrograms per cubic meter, but the EPA opted not to make any changes. The World Health Organization has established even stricter air quality guidelines, asserting that no level of fine particulate matter is safe for health. Yet the current administration seems to be taking steps that could further degrade our air quality by undermining the EPA, relaxing clean air regulations, and promoting fossil fuel use, which contributes to air pollution. We have a significant journey ahead to improve the air quality for ourselves and for future generations. Start today by implementing as many of the suggestions above as you can, and take action to enhance our air quality. As the American Lung Association aptly states, it's a matter of life and breath. Dr. William M. Simpson, Jr. is an emeritus professor of family medicine at the Medical University of South Carolina. How airborne pollutants increase dementia risk. New Cambridge study insights. Imagine waking up one day to find out that the very air you breathe could be silently sabotaging your brain health, putting you at risk of developing dementia. This chilling reality is now backed by a groundbreaking study from Cambridge, which reveals a disturbing link between airborne pollutants and an increased risk of dementia. But here's where it gets alarming. The research suggests that long-term exposure to fine particulate matter, nitrogen dioxide, and soot from traffic and wood burning can significantly raise your dementia risk. In fact, for every 10 micrograms per cubic meter increase in PM 2.5, your dementia risk shoots up by a staggering 17%, while soot exposure raises it by 13%. These findings are based on a massive review of over 29 million people and 51 studies, making them hard to ignore. And this is the part most people miss. The impact of air pollution on our brain health is not just a matter of personal choice, but a systemic issue that requires a fundamental shift in our transportation and energy systems. As Dr. Haze Craze, the senior author of the study, aptly puts it, tackling air pollution can deliver long-term health, social, climate, and economic benefits. It can reduce the immense burden on patients, families, and caregivers, while easing pressure on overstretched healthcare systems. But what's even more striking is that these microscopic particles can bypass our body's defenses, triggering inflammation and oxidative stress that damage nerve cells, ultimately harming not just our lungs and heart, but our brain as well. The study's findings draw attention to the alarming levels of roadside pollution in major UK cities, which frequently exceeded safety thresholds in 2023. So, the question remains, are we doing enough to address this growing concern? Should we be pushing for stricter air quality rules to protect our brain health? The answer, it seems, is a resounding yes. As we delve deeper into the links between air pollution and neurological disease, it becomes clear that this is not just an environmental issue, but a public health crisis that demands immediate attention. And this is where you come in. We want to hear from you. Do you think governments and policymakers are doing enough to tackle air pollution? Should individuals take matters into their own hands, or is this a problem that requires a collective effort? Share your thoughts, and let's start a conversation that could change the course of our health and our planet's future. Air pollution and dementia. What the latest study reveals. Imagine living in a world where the very air you breathe could increase your risk of dementia. This is not a dystopian fantasy, but a stark reality highlighted by groundbreaking research from Cambridge scientists. Exposure to specific types of air pollution is linked to a heightened risk of developing dementia, according to the most extensive study of its kind to date. The illness, which already affects approximately 57 million people worldwide, is projected to surge to at least 150 million cases by 2050. But here's where it gets controversial. The study, conducted by researchers at the Medical Research Council's Epidemiology Unit at the University of Cambridge, involved a meticulous review of 51 studies, encompassing data from over 29 million participants who had been exposed to air pollutants for at least a year. The findings are alarming and statistically significant, revealing a strong association between 3 types of air pollutants and dementia. These pollutants include PM 2.5, which comes from vehicle emissions, power plants, and wood-burning stoves and fireplaces, nitrogen dioxide, resulting from the burning of fossil fuels, and soot, originating from sources like vehicle exhaust emissions and burning wood. When inhaled, these pollutants can penetrate deep into the lungs, leading to various respiratory diseases and an increased risk of certain heart problems. More specifically, the study found that for every 10 micrograms per cubic meter of PM 2.5, an individual's relative risk of dementia would increase by 17%. Using equivalent figures for soot, the risk rose by 13%. And this is the part most people miss. Soot and PM 2.5 levels approached or exceeded these levels in 2023 at roadside locations in central London, Birmingham, and Glasgow. The most common cause of dementia is Alzheimer's disease, and in the UK, about 982,000 people are affected. Symptoms include memory loss, difficulty concentrating, and mood changes. Dr. Haneen Krees, the senior author of the study, emphasized that the research provides further evidence that long-term exposure to outdoor air pollution is a risk factor for the onset of dementia in previously healthy adults. She added that tackling air pollution can deliver long-term health, social, climate, and economic benefits. It can reduce the immense burden on patients, families, and caregivers, while easing pressure on overstretched healthcare systems. Air pollution may cause dementia through causing inflammation in the brain and oxidative stress, which is a chemical process within the body that can cause damage to cells, proteins, and DNA. The researchers acknowledged that the report was limited because the majority of studies analyzed included participants who were white and living in high-income countries. They said future studies on air pollution should include more participants from marginalized backgrounds. Dr. Isolde Radford, Senior Policy Manager at Alzheimer's Research UK, stated that this rigorous review adds to mounting evidence that exposure to air pollution, from traffic fumes to wood burners, increases the risk of developing dementia. Air pollution is one of the major modifiable risk factors for dementia, but it's not something individuals can solve alone. That's where government leadership is vital. While the 10-year health plan acknowledges the health harms of air pollution, far more needs to be done to tackle this invisible threat. Alzheimer's Research UK is calling for a bold, cross-government approach to health prevention, one that brings together departments beyond health, including DEFRA, to take coordinated action on the drivers of dementia risk. The report was published in the Lancet Planetary Health. So, what do you think? Should governments be doing more to combat air pollution, or is this an issue that can be addressed at an individual level? Let us know your thoughts in the comments.